This is where my new site, cemetery, Derby Cemetery. It's my oldest son that took his life through suicide 24 years ago. His name was Thomas, but his nickname was Porky.
It's been almost a quarter of a century since Glenys Benning's son took his own life. But she's still reliving his final hours, trying to understand why he did what he did.
Then I reflect and I think back on the signs there was there that day. He cooked my favourite dinner. He went and withdrew his last money. We had heart talk in my room. But little did I know he had his own plans on what he was doing or where he's going.
Her son Thomas was just 24 years old when he died. Not long before, he'd split with the mother of his young son and sought treatment for drug use. But Glenys says he seemed to be doing okay. It was in the middle of the night when a relative woke her with the news.
I thought I was dreaming, because I was half asleep. And he stood there and just kept repeating himself. And then I just went into shock. Couldn't go outside. Stayed in my room, maybe thinking I was dreaming. Yeah. I don't know. I still don't know.
"24 years later, she's scared that history is at risk of repeating. Her grandson, Thomas's son, has also been in distress, struggling with substance abuse and threatening self-harm.
And I caught tears in his eyes, and he was at breaking point.
Glenys took the 31-year-old to the local hospital emergency department, but she says they were shunted between units and staff seemed reluctant to take him into care.
Do my grandson need to be rolling around on the ED floor or screaming or get handcuffed by the police, then he get admitted in? Do we have to go to that extreme to get help? Or, what it has to take when someone talking, saying that he want to kill himself, to make that staff member realize that he wants help instead of showing the door.
In a statement, the WA Country Health Service has said it's reviewed the case and found no evidence of shortcomings in the care provided, and it's emphasised that staff would never release someone from care who's at immediate risk of self-harm. It's also offered to meet with the family to discuss their concerns. Glenys ended up caring for her grandson at home, while the family tried to get him into a residential drug rehabilitation program interstate.
For the 5 days he was here, before he caught his plane, we were on suicide watch because of what he was saying he wanted to do to himself. I looked after him here in home. I gave him my bedroom. I had a nephew and my son keeping an eye on him.
When the ABC visits, Glenys is looking forward to her daily chat with her grandson. Now midway through a 3-month program helping him work through addiction issues and past trauma.
Just checking how you've been.
Yeah, been good.
Been good? Yeah.
Yeah.
Yeah, I'm just so happy that you're there now getting help for yourself.
They just need to do something about when people go and ask for help, then treat people a bit better.
Glenys is relieved he's doing better.
Okay, Nana, then I'll hang up now and ring you again anytime, during the week.
Yeah.
Yeah.
All right. See you. Love you.
Love you, Nan. Bye.
Bye.
Every year, around 3,000 Australians die by suicide. And there's concerns the population's entering a high-risk period in the wake of the COVID-19 pandemic.
So what we've seen in the last 10 years, prior to the pandemic, was that we saw the rates were slowly starting to creep up. And then I think to the surprise of many of us in the sector, what we saw was flattening out of those rates during the pandemic. What we are seeing now, though, with increasing financial pressures on people and families, is a concerning rise in some of those rates in different states.
Historical data shows suicides often increase in the years following major international events like world wars, depressions and pandemics. So have we got any better at preventing suicide and self-harm? Professor Fiona Shan says there are many elements involved, such as community prevention programs, crisis response, mental health services, and addressing broader social problems like gambling and housing stress.
We're doing much better in Australia than we were, I think, in terms of making sure that people are getting better support at that crisis point. I think we also need to be stepping back from that and saying, what are we doing about access to high quality mental health? And that's an area where I think we're struggling a bit. Lots of wait lists to see psychologists and psychiatrists. Sometimes it's unaffordable for people, so I think that's an area where we can do better.
She says the science of stopping suicide is a relatively new field of study, but progress is being made. A holistic suicide prevention program called Lifespan has been trialled at 4 sites, and Professor Shan says the results are promising so far.
At the moment, we're just wrapping up the analysis of the Lifespan suicide prevention trial, and we've found some quite positive outcomes in terms of changes in rates of self-harm and suicide attempts in the 4 sites. So we're really encouraged by that. I suppose we did learn from that as well in terms of where to from here. So I think what we'd say is that we need to also be addressing some of those higher order factors like unemployment, like housing, alcohol policy, gambling policies.
Change can't come too soon for people like Glenys Benning, who dread the funerals that continue to be held for young people in her community.
It's normalised. You go into a funeral, that's just the funeral. It's just like normalised now, you know, as if that person died in a car accident or was sick. It took me about 10 years to talk about it before I first started going public and talking about I held it about 10 years before I talked to someone like a counsellor. Yeah, this is one of my favourite places I bring my grandchildren. It's very serene, very peaceful.
There has been good news for the family since the ABC wrapped up filming. Glenys's grandson is doing well. He completed 3 months in drug rehab and has told the ABC he's excited about starting a new job on the mines. But the Nigina, Bunaba and Gooniyandi elder is haunted by how close she came to losing him.
I would want the system to change, to make it more accessible and more understanding. I think people who, when we rock up an ED or mental health, to be more compassionate.